Hey, Dr. Evan here. Today we're going to talk about ticks, those most terrifying of parasites everybody's heard about, seen on the news, or as a friend with an absolute horror story. Ticks are insects that look a little bit like a small spider with 8 legs, generally brown in colour and range from 1mm to 2cm in size. There's about 70 different species of ticks in Australia, living almost everywhere, but they are especially common along the east coast. Ticks grow from an egg to a larvae about 1mm and then to a nymph at about 2mm, which is when they'll try to find a host to feed on. Now, ticks don't fly or jump, but crawl up grasses and twigs to then drop onto passing animals or humans, then attach themselves to soft, warm skin to feed and grow. Once they have attached, their saliva contains a chemical that stops blood clotting so they can feed for days. Most species of ticks in Australia are relatively harmless. However, many people are allergic to tick bites. It's also possible for ticks to pass on several diseases to humans, especially children, such as Lyme disease, tick typhus, Q fever, or babesiosis. Despite these threats, our knowledge of Australian ticks and tick-borne diseases is actually in its infancy. A new disease that was recently discovered, alpha-gal syndrome or AGS, also called red meat allergy, causes a serious, potentially life-threatening allergic reaction to red meat. This can be caused by just one bite from a tick, lasts your whole life and has no known cure. That's right, if they weren't already bad enough, ticks actually now possess a superpower to turn you instantly into a vegetarian. Even though there are many species, Australia has, as it always does, one particular critter that's 100 times worse than any of the others. The paralysis tick, or Ixodes holocylus, is a species of tick that lives on the east coast of Australia, from the very tip of North Queensland all the way down to Victoria. Now, thanks to climate change and urban spread, paralysis ticks have even been found affecting dogs, cats, and children even as far south as Tasmania. Side note, these paralysis tick maps you find on Google are actually very old, very, very outdated, and in no way correct. First of all, if you think your pet has been bitten by a paralysis tick or something venomous, you should take it to your vet immediately. Now, as the name suggests, this species of tick secretes a toxin in its saliva that causes muscle paralysis in mammals, which can lead to respiratory arrest and eventually death. The venom's effect starts at the base of the spine and works its way up, so the back legs and tail are generally affected first, and it progresses to the front legs. Your pet may also show signs of incoordination, reluctance to do normal exercise, inappetence, vomiting or regurgitation, excessive drooling, and really dilated pupils. This can rapidly progress to complete paralysis, the inability to breathe, and eventually death. Clinical signs of disease are usually seen around 3 days after attachment, but can show up just hours after being bitten, especially if your pup or kitty is very small. One of the first things an owner will notice is a change to their pet's vocalization, their meow or bark, especially in dogs. The tick's venom generally affects the vocal cords, which can make your pet sound a little bit funny. Kinda like when your voice broke as when you were growing up. We also call it a balk. And another telltale sign, no pun intended, is simply a limp or lax tail when normally erect. If you notice any of these signs in your pet, it's best to get them to a vet immediately to have a thorough check over and to maybe administer some anti-serum. Two things that I think are really important to talk about. One is not everybody lives in a paralysis tick zone in Australia and has to have tick protection. And two, even those on preventatives should still check their dog or cat for ticks daily, especially if they're outside pets. Now, don't worry though. A tick check is very simple, only it takes about a minute and you don't need any special devices or tools to do it. It's basically a glorified pat, so your pet will generally be more than happy to oblige. The best time to check them over is when your pet has returned from a walk or simply been outside. Now be methodical in your approach. Start at one end and work your way down so you don't miss anything. Simply running your hands all over your pet, the glorified pat, and feeling for any small lumps or bumps is the easiest way to start. Ticks tend to be found around their neck, head, underarms, ears, groin, and feet. These places are generally a little damper and warmer, so ticks absolutely love them. Make sure you check inside the ears as well as between the toes. Daily grooming with a good brush can also help to remove any ticks from your pet's fur as well. By following these simple steps, you can have your dog or cat live happier, healthier lives all day, every day. Talk soon.